The liver is not only the largest but also the hottest and most multifunctional internal organ in the human body. It doesn't stop working, day or night. What's truly remarkable is the liver's ability to regenerate and heal itself. However, despite its remarkable capabilities, the liver can also become unwell. Various factors can influence the liver's health. Proper nutrition is especially important. There are foods that contain substances particularly beneficial for the liver, and there are those that should be avoided to prevent overburdening and harming this organ. The features of the liver. The liver is primarily located in the right upper abdomen, with an average weight of about 1,500 grams in adults. It is covered by a thin capsule that protects its tissue from external influences. Structurally, the liver is divided into two lobes, the right and left. The liver's temperature is around 40 degrees Celsius, which is understandable, considering that about 1.5 liters of blood pass through it every minute. Inside the liver cells, there is a constant and vigorous detoxification and blood cleansing process. There are few pain receptors in the liver tissues, so initial signs of liver diseases and chronic processes within it often don't cause any painful sensations. The liver performs a multitude of functions, with some authors counting them at over 500. Thanks to the intensive work of this organ, the body's internal environment remains stable, ensuring the functional activity of all organs and systems. Liver functions. The liver's functions can be categorized into several main areas. Metabolic function. The liver regulates the body's fundamental metabolic processes. It plays a role in the metabolism of proteins, fats, carbohydrates, vitamins, minerals, and other biologically active substances that come from the external environment or are produced within the body. Synthetic function. The liver is responsible for the synthesis of various essential substances in the human body. It produces hormones, blood clotting factors, cholesterol, enzymes, and transport proteins. Detoxification. Liver cells neutralize toxic substances, including those found in food, generated during metabolic processes, and produced by microorganisms. Toxins and poisons, as they pass through the liver's filters, become less dangerous or completely harmless to other organs. They are converted into waste products and eliminated from the body. Storage. The liver serves as a reservoir for important substances like glycogen, a stored form of glucose, proteins, lipids, vitamins A, D, B12, iron, and copper. Approximately 10% of the body's blood supply is stored in the liver, which can be mobilized to help in cases of blood loss or shock. Secretory function. The liver produces bile, which is necessary for proper digestion. Bile is collected in the gallbladder and, when needed, is released into the duodenum, a part of the small intestine. Excretory function. The liver participates in the removal of excess substances, end products of metabolism, and unwanted compounds from the body. These substances are excreted into the bile and subsequently eliminated through the intestines. Liver diseases. Issues with the liver can either result from a disease originating within the organ itself or serve as a symptom of systemic problems affecting the entire body. For example, the development of cardiogenic cirrhosis of the liver is a consequence of heart failure or heart defects. The liver can also be exposed to the toxic effects of various microorganisms, leading to infectious diseases. Liver damage can occur in the context of infectious mononucleosis, sepsis, abdominal typhus, and other infections. Among the direct causes of liver diseases, the following are noteworthy. Viruses causing viral hepatitis. These include hepatitis A and E viruses, which are transmitted through the oral-fecal route, and hepatitis B, C, and D viruses, which are transmitted through blood and sexual contact. Alcohol, leading to inflammation and subsequent cirrhosis. Poor, unhealthy dietary habits that disrupt metabolism and lead to obesity, resulting in fatty liver disease and gallstone formation. Prolonged use of medications that can induce drug-induced liver toxicity, elevate liver enzymes in blood chemistry, and cause discomfort on the right side. Such medications include antibiotics, non-steroidal anti-inflammatory drugs, cholesterol-lowering agents, and some others. The presence of metabolic syndrome, diabetes, systemic, and autoimmune diseases. The clinical manifestations indicating the need for liver assistance can be categorized into specific signs primarily associated with liver diseases and secondary symptoms that may also occur in other conditions. The most common manifestations of liver damage include discomfort and heaviness in the right upper abdomen, which is not dependent on food intake or body position. The sensation of bitterness in the mouth, nausea, and heartburn. Jaundice, characterized by the yellowing of visible mucous membranes and skin. Skin itching of varying intensity. Darkening of urine color and lightening of stool color. Other symptoms that may occur in cases of liver dysfunction include pronounced weakness and excessive sweating, accompanied by weight loss. Tendency towards bleeding. Increased fragility of capillaries leading to the formation of bruises. Swelling in the lower extremities and ascites. Accumulation of fluid in the abdominal cavity. Intermittent, episodic fever. Sleep disturbances and a decline in mental capabilities. Liver diseases are categorized into groups, each containing specific pathological conditions. Hepatitis, which is inflammation of liver tissue. It can be viral, toxic, drug-induced, or metabolic. Fibrosis or cirrhosis of the liver, characterized by the replacement of liver cells with connective tissue. It can be viral, alcohol-related, or cardiogenic. Liver abscess, which can be caused by parasites, such as amoebas, or bacteria. This leads to a focal area of purulent inflammation within the liver. Liver tumors, which can be benign or malignant, resulting from viral or alcohol-related damage, or as a consequence of metastasis. Fatty infiltration, where fat accumulates in liver cells. If liver function remains unaffected, it's called fatty liver. If there is an elevation in liver enzymes in the blood, it becomes fatty hepatitis. Liver cysts, the formation of cavities within the liver tissue. This can occur due to certain parasitic infections, such as echinococosis, after trauma, following hepatitis, or as a congenital defect. Harmful foods for the liver. For those with liver diseases or looking to maintain liver health, it's essential to eliminate liver-damaging foods from their diet. These include all forms of alcohol, sugary carbonated beverages, and reconstituted packaged juices. Processed meat products like smoked meats, sausages, salami, and hot dogs. High-fat dishes, fatty cuts of meat, and dairy products. Rich, hearty broths and soups, both meat and fish-based, as well as mushroom soups. Store-bought sauces, mayonnaise, and margarine. Fresh, especially white bread. Vegetables high in extractive substances, particularly radishes and turnips. Sour fruits and berries. Canned and pickled foods. Any offal or organ meats. Fast food and products containing trans fats. Consuming these listed foods places additional strain on the liver, exposing liver cells to toxins and disrupting their metabolism. This leads to inflammatory changes, fat accumulation, and the formation of fibrotic areas. Improper nutrition gradually deteriorates the liver. In its early stages, there may be no detectable issues thanks to the liver's high regenerative capacity. However, if overeating and primarily consuming liver-damaging foods after the compensation stage, the following stages are inevitable. The stage of subcompensation, marked by the appearance of initial symptoms. Digestive disturbances are noticed. There's a sense of heaviness on the right side, and an enlargement of the liver is detected. The subsequent stage is irreversible and characterized as decompensation and liver failure. These developments can be attributed to the formation of liver fibrosis or the development of primary liver cancer. to prevent such disturbances in liver function and protect the overall well-being of the body. In addition to avoiding harmful foods, it's essential to consume foods that have a positive impact on the liver and contribute to its health preservation. Foods beneficial for the liver. To maintain the high performance of the liver, it is advisable to incorporate the following foods into your diet. Pumpkin. This autumn vegetable contains pectin and vitamins that are beneficial for liver cells. Pumpkin has regenerative properties and helps eliminate toxins while accelerating bioproduction, which is favorable for the liver's health. Cantaloupe. Cantaloupe aids in cleansing liver cells of trapped toxins and possesses bile-stimulating effects, slowing down the degradation of liver cells and the formation of fibrosis and fat deposits. Artichoke. This specific vegetable, used in culinary dishes, significantly influences the liver positively. Consuming artichoke accelerates bile flow, normalizes biochemical processes in hepatocytes, liver cells, cleanses bile ducts, and promotes cholesterol breakdown. It's no wonder that artichoke extract is a component of liver-supporting tablets. Lemon. This citrus fruit with high vitamin C content serves as a preventive measure against fatty liver disease and promotes bile secretion. Bananas. These tropical fruits contain amino acids that contribute to the formation of new liver cells. They are rich in simple carbohydrates that do not burden the liver with additional effort, thereby preventing overload. Watermelon. Doctors recommend this giant berry for individuals with hepatitis and other liver diseases. Its juicy pulp rinses and purifies the liver, reduces the risk of stagnant manifestations, and the formation of stones. Green tea. Renowned for its beneficial properties, green tea contains vitamins and antioxidants that normalize metabolism in liver cells. Kefir. This fermented milk product supports intestinal microflora, reducing the accumulation of toxins in the blood resulting from food residues in the colon. As a result, the liver expends less energy on detoxification, and stomach bloating and flatulence are minimized. Walnuts. Walnuts contain essential fatty acids involved in the construction of new liver cells. Additionally, the silicon present in walnuts reinforces hepatocyte membranes. Honey. This bee-produced product is a natural remedy for the liver. It contains all the essential ingredients for liver cell regeneration, as well as glucose, which nourishes, enhances energy potential, and facilitates the penetration of beneficial substances into liver cells. Moreover, the liver benefits from a fractional diet, where individuals eat frequently in small portions. Additionally, cooking methods that are preferred include baking, steaming, boiling, or stewing. Proper nutrition plays a vital role in maintaining liver and overall health.